Hi, it's Gary Chimes from Lake Washington Sports and Spine, and what I want to talk about is health optimization, especially in the setting of COVID-19. So COVID-19 is very scary for everybody across the country, but especially people like us who are right in the epicenter in the Seattle area. And one of the things that's really important is that COVID-19, right now we don't have any actual treatments for COVID-19. So your ability to do well while COVID-19 is out in the community, if you end up getting it, it's going to be based on what your baseline health is. And one of the really important points that we want to emphasize is that health is not the absence of disease. Health is your baseline standing in terms of how your body's functioning, and that gives you resilience in the setting of disease. So you can do things like social distancing and quarantining to minimize the chance of you getting exposed to the virus. But I think there's definitely a possibility that we're going to get exposed, whether you do social distancing or not, and whether you end up getting really sick from this is going to be a function of what your baseline health is. So what are the things that you can do to protect your health? And something my partner, Dr. Hyman, and I have talked about for a long time is what we call health optimization. It's going to be, and these are going to be the 7 core principles of health optimization. And we feel pretty strongly this is the order you want to focus on. So the 7 core principles of health optimization are going to be simplicity, sleep, diet, exercise, stress mediation, toxin reduction, and social connection. So the reason we start with number 1, simplicity, is you only have 168 hours in a week, and your ability to take care of the things you need to do is going to be based on what you do during that 168 hours. So every time you spend time on something that's low leverage, that takes away from your ability to do something that's high leverage. So really protect your time and try to make sure that you're not spending a lot of time on things you don't need to. I think using calendars is going to be really important. A lot of you are going to have disruptions of your normal routine, so things that used to be automatic are now going to be stressed. So making sure that you document on a calendar, using a shared family calendar, or on the side of over communicating, because the biggest time sink is going to be things that take more time than you think they're going to. Another thing I want you to take in mind is that all the businesses across the entire country are going to be operating at less efficiency than they used to. So phone calls that used to take 5 minutes might take 20 minutes. So those are things like build into your schedule that things may not work as well as they normally do. The other thing is just try to minimize the number of decisions you need to make. So, if you're thinking about a home remodel, now might not be the time. If you're, so those are things to really think about from a simplicity standpoint. Second thing is sleep. Sleep is super duper important. And a lot of you are actually going to have some surpluses of your time because you're going to be commuting less. Really try to get to bed earlier. That's going to be really critical. A lot of people think that you need 6 to 8 hours of sleep, but really it might be closer to 9 to 11 hours of sleep. I recommend using a fitness band if you can. That way you can actually monitor how much of the deep sleep you're getting, which is really the most critical part for restorative function. And if you get an infection, your ability to fight that infection is really going to be a function of how much sleep you get. So really prioritize that as much as you can. And when you're working on simplicity, the one thing I want you to protect the most is your sleeping time. Next thing is diet. Now, diet is a very big topic, very broad topic, and I think the key thing is trying to minimize how much crap you're eating. That's going to be the big one. Right now, a lot of us might be using more kind of foods that are non-perishable. While the things are still fresh, though, I would encourage you to get perishables, because perishables often include leafy vegetables, fruits and vegetables are going to be really critical. So trying to eat as much of that as you can. And then if things get worse and you have to eat the non-perishables, you go ahead and do so. Make sure you're getting enough protein. Almost everybody needs at least 30 grams of protein per day. So those are things that are important. Next thing is to be exercise. And this is an easy one to let go of because, maybe you have to cancel your appointments with the personal trainer or you just have other things going on. There's a lot of components of exercise that are important, but aerobic conditioning is really the most important one. And for most people, what that means is at least 30 minutes of aerobic conditioning 5 days per week. So try to make sure you get that. And in terms of making sure you're exercising hard enough, you need to be exercising at a pace where you can't sing, but you are able to talk. And that would be considered moderate exercise. So 30 minutes of aerobic exercise at an intensity where you can't sing 5 days a week. Next topic is stress mediation. Obviously, this is a very stressful experience. Try not to fret over the things you don't need to. Often daily meditation can be really helpful. The Headspace app is a really good choice. Trying to get 10 minutes of meditation in daily. Certainly have periods where you just unplug. I think everybody, especially if you're all crowded into the house, have some blocked out time where you say, hey, mama needs some time for herself right now, and just get those 10 minutes, because otherwise I think the stress can start piling up and that can really have detrimental effects on your immune system. Toxin reduction. Toxins are just basically anything that inhibits your ability to interact with life. I would say the biggest one to avoid right now are toxic relationships. Particularly, a lot of us might be spending more time on social media right now. Just don't get pulled into into a social media fight that you don't have to. I think that's probably the number one thing to reduce. Really try to spend quality time with the people that are important to you, and that leads into the last one, which is social connection. That's gonna be really critical, I think, especially with like your parents and grandparents, to maintain that connection. Take advantage of social media, FaceTime, phone calls. Make sure those connections are being maintained, especially for older people, because a lot of times we're trying to minimize contact with older people so that they don't get affected with COVID. So if you can make a point of calling your mom every day, doing a FaceTime with grandma, doing a phone call to your father, those are all things that are going to be really valuable. If you want to learn more information about this, a couple resources for Lake Washington Sports and Spine. Our email is lakewass.com, and our phone number is 425-818-0558. We are starting telemedicine visits, so we can use those as mechanisms if you want to go through how to do health optimization. If you want to learn stuff more specifically about our health optimization program, it's healthoptimizationprogram.com. This is Gary Chimes, my partner is Garrett Hyman, and I hope everybody stays healthy.